Can you hear me? Hi everyone. Thank you for coming down this afternoon. We have Dr. Joshua Kaye here with us, who is the physiatrist from MAHV, located in the Hudson Valley. So, Medical Associates of the Hudson Valley, sorry. So he's here to kind of introduce himself, his specialty, what it is that he does now, what it is he will be doing at Woodland Pond, services that he will be offering, how you can visit him, and so forth. So let's let him do his spiel a little bit. He'll explain all of those things I just mentioned, and then we'll have some time for Q&A, and if we have any additional points of concern. So without further ado.
Thanks, Cameron. Hi, everybody. Thanks for coming out.
Maybe you hold it.
Yes, if you feel more comfortable holding it, that's
Okay.
walking or whatever you feel more comfortable with, it's fine. Take it off of there. Just attach.
Yeah. So my name is Dr. Joshua Kaye. I specialize in physical medicine and rehabilitation, also called physiatry, also called rehabilitation medicine. We have several different names, and a lot of people have never heard of our specialty. So when I tell people that I'm a physiatrist, often they respond with, "Oh, so you're a foot doctor." No, I'm not a foot doctor, I'm not a podiatrist. "Oh, okay, so you treat depression and anxiety." "No, I'm not a psychiatrist." So then they say, "Okay, what's the name of your specialty again?" "Physiatry." "Oh, so you're a physical therapist?" "No, not quite, but I work with them." So my specialty, physical medicine and rehabilitation, or PM&R for short. I'll give you a brief history. So the specialty began about 100 years ago. After the First and Second World Wars, we had the vets coming home. They were injured. They had needs for rehabilitation for their functional impairments, various injuries, and they needed a multidisciplinary approach to their rehab. So medical doctors needed to be involved with the rehab. In 1945, the specialty emerged and was accepted by the AMA, and by 1946, there were about 25 residency programs throughout the United States in the specialty. So we started out as an inpatient specialty, working on the rehab units in the hospitals with PTs, OTs, and speech therapists. Over the recent decades, we've branched out into the outpatient arena to treat various orthopedic conditions, because a lot of orthopedic conditions can be treated non-surgically. And as physiatrists, we have a great understanding of the musculoskeletal and neurologic system to work in this area. So over recent decades, we've been branching out into outpatient offices. You see a lot of us working in orthopedic practices, neurology practices. So that's pretty much what I do. I focus on treating pain caused by various conditions, mostly orthopedic conditions, musculoskeletal conditions, even some neurologic conditions, any conditions related from a trauma, injury, car accident, slip and falls, and also degenerative conditions. So just like osteoarthritis of the knee. So I treat these conditions non-surgically. So let's say a patient comes to see me and they tell me that they have pain in their knee. I'll do the diagnostics, order any tests that are needed, whether it's x-rays, MRIs if needed. We'll come up with a diagnosis and a treatment plan. Most of the time that involves rehabilitation. That's the center of my rehabilitation plan. So usually it's PT, or if it's the upper extremity, OT. And then I'll prescribe any medications that are needed for the pain, do any injections that are needed, and if there's any type of durable medical equipment that's that would be beneficial, or any bracing, I would prescribe that. And I stay in touch with the rehab department, and they would let me know how the patient is doing in their PT or OT. And if they're making improvement, great. If they're not, I find out why, and we treat it. And that's essentially what I do. That's what I focus on. Also, any type of decline in function. So if you find that you're getting weaker, deconditioning, whether that be from a prolonged hospital stay or illness, or just decline in function from aging. I see patients for that, and most of the time I refer them to PT or OT. Whether it be difficulties with mobility, or it's just more difficult to take a shower, get dressed, and just difficulties with self-care. So that's what I do. Any questions? Yeah.
Why don't we, what's the question?
Do you have to be in physical therapy to begin with you?
Good question. You don't have to be in physical therapy. You can see me first if like, let's say you see your primary doctor and you tell them, oh, I've been having back pain, neck pain, shoulder pain. I had a fall a couple of weeks ago, injured my knee. I took some Advil, it didn't get better. Their primary doctor may refer you to me. I don't require referrals, so you're free to contact my office, and I think we may have some appointment.
You want to go over that, or do you want to go over how we're going to do that?
Yeah, maybe at the end you could
Okay.
talk about that. So yeah, we'll give you more information about that at the end, but we're gonna make it really easy for you to make an appointment to see me. And as long as your insurance doesn't require a referral, I don't require a referral. If you're in physical therapy for another issue, and let's say you have a history of arthritis in your knee which flares up while you're doing exercises in PT, and your physical therapist says, I want you to see Dr. Kaye, he can help you with that knee pain so you can participate better in physical therapy, then they may make a referral to me. So to answer your question, no. Yeah.
I'm a little confused. I wonder if you would clarify this. Do you do physical therapy in your own practice?
No, I don't. I mean, I might be able to teach you a stretch or two while you're seeing me, but I usually leave that for the therapist.
So are you saying essentially you are a diagnostician?
Yeah, that's part of it. That's part of it. And also any medications, injections, braces that would benefit you with whatever condition you have, I would
So you
prescribe.
do injections,
Yeah.
like cortisone, et cetera, et cetera?
Yeah.
Mm-hmm.
Yeah.
Okay, thank you.
Yeah.
I have two questions. The first one is, what is your existing relation? What is your existing relation, or what would be your existing relation to the present physical therapy and to the health service in general? Would you be an attending? Would you be a consultant? Or you would be a private practitioner with office space? The second question is, do you have access for referrals for patients requiring prosthesis, requiring orthosis, bracing, and speech and hearing?
Sure. So I'm part of Medical Associates of the Hudson Valley. We have multiple offices in the area. I'm mostly in the Kingston office, and then once a month in the Poughkeepsie office. So I'm going to be here on Friday mornings, but as part of my private practice. So if that answers your question, I'm part of Medical Associates of the Hudson Valley. I would be considered, I suppose, a consultant. The primary physicians can send me the referrals, and then I would manage the musculoskeletal conditions that whatever the patients have, be it arthritis, neck or back pain, issues with mobility. And then as far as your other questions with prosthetics and orthotics, I don't typically manage prosthetics for like amputations, but if I see a patient who, let's say they have sciatica and they have weakness in their foot, they have a foot drop, and they need a brace around their foot to help them walk better, I would certainly refer them to an orthotist in the area and prescribe it would be the ankle foot orthosis, if that answers your question.
Not really. No, the other is, what is your status in relation to rehabilitation?
Put the mic by your mouth.
Your status in relation to rehabilitation here. Are you a consultant physician? Are you an attending physician? Or a physician with office facility here? It's a very important question because it relates to payment.
Okay, so Dr. Kaye we're using as, I suppose, what you would be considering a consultant physician. So basically, we'll get more into this as to how we can go about the scheduling purposes, but Dr. Kaye will be with us on Friday mornings with an office space over behind reception in the health center. So now with that being said, he is not necessarily employed by Woodland Pond. We have contracted with Dr. Kaye's office in order to have him once a week or more if ever needed. But he's not employed through Woodland Pond. He just is solely using Woodland Pond's space out of the convenience for our residents to see him here.
Does Medicare pay for this?
Yes?
Okay.
My husband had, because of the collapsed ankle, there's no more cartilage left in it. Is that something? Sorry. My husband has what he calls a collapsed ankle with no cartilage left in there. Is that something you can help?
Yes, potentially. I'm happy to see him. I do conservative management. So if the conservative treatment didn't work and he needed to see a surgeon, then I would make that recommendation. But we could start with conservative treatment and go from there.
Thank you.
He's not very good with a mic either.
Okay, so quickly to explain the way that this will be going, because I'm sure that we'll have some questions. We'll have some wrinkles that need to be ironed out throughout, but generally the way that we're looking to establish this is we will be having an intake form today, in addition to an intake form that can be available through myself, Sarah, MJ, Angel, should you be interested. So now with that being said, that intake form, will jot down your name, your information, what it is that you have a chief complaint about, and then his office will go ahead and reach out to you so that it's seamless and easy and we can get something scheduled. With that being said, I know that we have some residents who see the therapy department over in the health center. Sometimes there might be an instance where they may feel that a referral is necessary, even though you are already seeing one of our therapists in the therapy department. Now, they can also make the referral. And then on top of that, we have Dr. Kaye's business card and pamphlets available where you are also able to call the office and make the appointment yourself should you feel the need to do so. So there are a lot of different avenues that we can do so. We will have his information readily available, and there's a whole different way of opportunities to make this work for everybody who was interested in seeing him.
Do you deal with pain control?
Yeah, good question. So there's a lot of confusion with my specialty. A lot of people think that I'm on pain management. So it's good that you brought that up so I can clarify. I treat pain, but I'm not a pain management physician. There's a boarded specialty called pain management. That's not me. I'm a rehab medicine specialist. So within that, I do treat pain, but I treat it with a multidisciplinary approach, including rehabilitation medications and injections. In some instances, I may prescribe an opioid or medication or a controlled substance, but I just do that for the short term, and then I would refer the patient to a pain management specialist if they needed to be on that medication long term. And I don't do the epidural injections, the spinal injections, if you're referring to that as well. For that, the question is do I help people get off of controlled substances? Honestly, you're better talking to either the physician who prescribed that medication for you or a pain management specialist, just so you don't go into withdrawal.
Any other questions? Okay, so we have Bree, who is the front desk manager for the office. She has some intake forms that people can, we can circulate around, some different forms, and you can fill out your information. Like I said, today is not the only chance to do so. If you don't feel that you want to fill it out now, we can, you can contact myself, Sarah, MJ, Angel, the therapy department, concierge, with any type of inquiry that, you may be interested, and, we can go from there.
When do you start your consultations?
So Dr. Kaye will be starting this Friday. I believe he has some availability in his schedule right now. So if you're eager to see him, you can come and see him on Friday if you give the office a call or if you let them know how soon you'd like to see him. But he will be here on Fridays from 8:30 until... Okay, so he'll be here as early as 8:30 and then however long, he has appointments for.
How long is a session?
So for the first visit, it would be, if needed, up to about 40 minutes is what I typically block out. It might be less than that. It just really depends.
And then after that, how long?
Follow-ups generally are quicker unless like an injection is needed, then we have to allow time for that. But if it's just like a follow-up, it can go pretty quickly. I would say 15-20 minutes.
Do you treat arthritis?
Yes, I do. I see a lot of that.
Anybody else? Oh. Right there, Joe.
Do you treat osteoporosis, and are you allowed to give the Prolia injections?
No. Do I treat osteoporosis? I don't.
So you seem like a young person. How long have you been in this specialty?
Well, thank you. I graduated residency 10 years ago. So 14 years, when you count my training. Thank you.
Another question, do you do manipulation?
I don't. So I'm a MD, I'm not a DO. And so for anybody who doesn't know what that is, there's two ways to become a physician in the United States. There's Doctor of Osteopathic Medicine, and then there's the traditional MD pathway. That's me. So the DOs learn the osteopathic manipulations. I didn't get the training in that.
Okay, so if we have no more questions, I'd like to give a round of applause for Dr. Kaye and thank him for coming. We will have the intake forms up here and we'll circulate them around, so if anybody is interested, and we'll be around if you have any other remaining questions. Thank you.
I still don't understand how you pronounce the specialty.
She's,